session is all about applying to medicine and dentistry. Hopefully there's lots of you who are thinking about applying to medicine and dentistry, and that's why you're here. If you're not thinking about applying to medicine and dentistry, feel free to leave. You don't have to stay on, but hopefully you've joined because you are thinking about that and you want to find out a bit more about the application process and about those degrees at Newcastle. There'll be lots of chance for questions, but feel free to put any questions. The chat will be disabled, but you can put questions in the Q&A. Micah might be able to answer some as I'm talking, but if not, we'll answer a few at the end. We should hopefully have time for a few questions at the end. So if you've got any questions as we go through, please feel free to put those in the Q&A. So what we're going to cover, I'm going to talk a bit about the medicine and dentistry programmes at Newcastle and our teaching styles, what we do sort of year by year on those degrees. And then I'll go over the application process. We'll look at the UCAS timeline, the UCAT test, which is the admissions test for medicine and dentistry. I'll go over personal statements and what you need to sort of be thinking about when you're writing your personal statements, the interview process for medicine and dentistry, and our admissions policies. And then I'll be talking about our partner supported entry scheme as well. So what is medicine at university? It's the study of the human body and human diseases. On a medicine degree, you'd be taught about all the different diseases and human body functions and things like that, diagnosing treatments and the use of modern medicine. It's a degree that's awarded for studies in various fields and related to medical surgery. So you study things like clinical skills when you're on a medicine degree. And what is dentistry at Newcastle university? Dentistry is the study of human dental structure, function, behaviour, clinical dental studies and related sciences. As a dental student, you'd learn about the treatment and prevention of a wide range of diseases, such as tooth decay to oral cancer. And as a dentistry student, you develop your skills that would be required to provide oral healthcare for patients. So it gives you all the skills and knowledge that you need to work as a dentist after you graduate. There's different teaching styles of medicine degrees. There's a traditional style, which is more sort of what you'd expect to see at universities like Oxford and Cambridge. If you were to study on a traditional course, your medicine degree would be divided into sort of more clear structure. So you'd have 2 or 3 pre-clinical years, which would be sort of classroom-based, where you'd be doing lectures and seminars at university. You'd be doing that for 2 or 3 years. And those would be then followed by 3 clinical years, where you'd be sort of more out in hospitals, seeing patients under the supervision of a consultant, but having lectures throughout those clinical years as well. So with those traditional courses, you'd kind of learn the underpinnings of medicine, you'd learn the scientific sort of theory behind it all, and then after that you'd go out into the clinics and wards and hospitals and places like that, alongside lectures to sort of solidify your learning as you're working on the ward. Another type of medicine degree is problem-based learning, and on degrees that are taught in this way, you'd be presented with a problem or case study in small groups, and then you'd research and gather information sort of related to that case. You do a lot of sort of personal research, independent research. You'd be working in groups to compare your research and notes with others, and then you'd also have lectures which would help consolidate your knowledge. So this sort of teaching approach is very much self-directed learning. So when you're looking at different medicine degrees, you need to think about how you learn best and what your best way of learning is. Obviously, if you're not somebody who is good at learning, sort of researching by yourself, a problem-based learning teaching style is probably not for you. And finally, there's integrated courses. So on an integrated course, this is how we teach at Newcastle. So on an integrated course, you'd be taught your scientific knowledge, so your theory, alongside the clinical training, so your practical sessions. And the material will be covered by looking at body systems. For example, you might be learning about the digestive system, and then as part of that, you'd learn about things like biochemistry, anatomy, and physiology. This is the way that the General Medical Schools Council recommend teaching a medicine degree, and as I said before, this is how we teach it at Newcastle. So at Newcastle, in years 1 and 2, there'd be varied teaching styles. So there'd be lectures, clinical skills. If any of you have been on any of our open days or experience days, you might have seen our clinical skills department in the medical schools. You'd be doing sessions in there. You'd be attending seminars and lots more different ways of teaching and learning in years 1 and 2. You'd study a series of clinical cases in those years, and you'd also have lots of links with community-based practitioners as well, where you'd get out and about and you'd get relevant experience, and you'd be out with patients in years 1 and 2. In year 3, you'd have a 15-week introduction to clinical practice, and you'd be attached to a world-renowned government hospital. For example, the RVI in Newcastle is right next to our medical school. It's actually attached to our medical school. You can walk directly through there without even going outside. So that's one hospital where you could be attached to as a year 3 medical student. And you'd have placements in lots of different specialities. And there's also lots of different student-selected learning as well. So you can sort of choose what you're learning to some extent as well. In year 4, you'd have longer placements, and you'd also have the chance to do an 8-week elective, which can be in the UK or overseas. And then in year 5, you're preparing more for your foundation training. So it's really preparing you for graduating, for going out and practicing as a doctor. And you'd also do further clinical placements in year 5 as well. So there's clinical placements throughout your degree. As you can see in years 1, 2, 3, 4, and 5, you're out in hospitals, community-based practices, places like that, to get all their experience that you need to then go out and work as a doctor. So as I said before, Newcastle use an integrated case-led approach, our degree is professionally accredited by the GMC, which is the General Medical Schools Council, but every medicine degree will be accredited by them. So that's not unique to us, but it's just to let you know that is the case. There's lots of different opportunities for studying abroad. If that's something you're interested in as a medicine student. For example, in year 2, you can go to our Malaysia campus, which is called NewMed. You go there for 1 semester, and the campus in Malaysia, you can see the photo there with the arches. They teach the same degrees we do at Newcastle, you're just doing it in Malaysia. So that's a really good opportunity for students who want to go out there and experience a different culture, different weather, for example, and just have that different experience of 1 semester as part of your degree. In year 4, as I said before, you could do an 8-week elective. You can do that in the UK, but you can also do that overseas, and lots of students choose to do that overseas just to get a bit of, if they want to travel and they want to see different healthcare systems in different countries and how they work. So that's an opportunity that students can take as well. We also have the opportunity for intercalated study at Newcastle, which means that you can do a master's as part of your degree. So it adds a year onto your medicine degree, but it's a really good way of getting a master's degree as part of your medicine degree. Lots of students do things like a master in public health, for example, or a different area of health that you might be interested in, and that's integrated into your degree for 1 year. So when you come out, you've got your medicine degree, but you've also got a master's or a master of research as well as part of that. Our entry requirements at Newcastle for medicine are 3 A's, and we don't actually have any subject requirements. I think we're quite unique for that. As far as I know, there's not any other medical schools that don't ask for any subjects. You don't have to do in biology or chemistry, for example, but we do ask for 3 A's. The reason we don't ask for any specific subjects is because we teach you everything you need to know. What we want to know when we're considering your application is that you've got the academic capability, but we teach you all the subject knowledge that you need to know as a medicine student. We also look at your UCAT score, which is an admissions test that you need to take when you're applying for medicine or dentistry, and you need to have a score that is sort of above our cutoff, and each year the cutoff does change for that, and we can't tell in advance what it's going to be, but you do need to do UCAT in the year that you're applying. And we also interview, and at Newcastle we do what we call multiple mini interviews, but I'll be talking more about those later. So I'll tell you a bit about dentistry now. Okay, hopefully some of you are interested in dentistry as well. So there's different teaching styles for dentistry as well. So on a dentistry degree, you'd have lots of clinical exposure. You'd be in sort of dental hospitals, and you'd be integrated within the team and learn within a team. You'd be responsible for patients. You'd later on in your degree, you'd have your own patient caseload that you would be responsible for. There's also lots of varied teaching. So there's seminars and lectures and clinics that you'd be attending as part of a dentist, as a dental student. In years 1 and 2 at Newcastle, there's lots of varied teaching, which includes lectures, clinical skills teaching, and anatomy teaching, so similar to that on the medicine degree. You'd also shadow students who are in later stages of their degree in our dental hospital, which is right at, it's on our campus in our dental school. So you'd shadow students who are in later years of the degree on their clinics, and you'd get to see patients and talk to patients and shadow students doing their work and dentists doing their work in the dental hospital. You'd also cover basic biomedical sciences as a basis for your clinical work as well. In year 3, you'd have your own patient caseload, so you would manage that, and that is under close supervision, obviously, but you would have your own patients that you would manage. You'd be placed in the dental hospital, which would be for 43% of your learning time, so nearly half your time would be in our dental hospital. So it's a very practical degree from in year 3 onwards. And you'd also study things like pathology and microbiology to gain initial grounding in disease processes. So you'd have that knowledge and that background study to help you then treat your patients. And there's also some student-selected learning components as well. In years 4 and 5, you'd be spending half your time on patient care and in clinical dental practice, and you'd also then have teaching that would be related to your clinics. You'd be learning about more advanced techniques, so things like orthodontics, dental implants, and intravenous sedation. So as you go through the degree, you're learning about more advanced dentistry. And obviously, you'd then have students shadowing you, as you shadowed when you were in year 1 and 2. You shadowed year stage 4 and 5 students. You'd be providing that as a sort of in the later stages of your degree as well. So our dentistry degree is professionally accredited by the General Dental Schools Council. We have really great facilities. If you haven't already been on an open day and done a tour of our dental school, I really recommend it. We've recently invested £5.5 million into our facilities, and we've got some really state-of-the-art facilities in our dental hospital that students use every day as part of their degrees. So if you do come on an open day, I really recommend doing a tour of the dental school and seeing those facilities. We also have study abroad opportunities. So in year 4, you can do an elective, which is for the dental surgery students. And again, you can do that overseas if you wish to. And there's also opportunity for intercalated study, as there was in our medicine degree as well. Our entry requirements for dentistry, like medicine, are 3 A's, but you do need to have biology and chemistry for dentistry. And we also look at your UCAT score. The interviews are different for dentistry. We do panel interviews rather than the multiple minute interviews. So that's more like a traditional interview style. But again, I'll go into more details on that shortly. But I've told you lots about studying and what the degree involves as a medicine or dental student, but there is lots more to being a student at Newcastle and elsewhere to just the studies. There's lots of different societies you can join. We have societies in anything you can really imagine at Newcastle, but if there is something you want to join a society for that isn't already there, you can start your own society. There's also lots of sports teams. There's also opportunities to work within your sort of subjects. So you can work as an outreach dentist or medic. So that means you could go out to schools and sort of work with students who are sort of in, secondary school, even primary school, and work to sort of encourage students to take an interest in dentistry or medicine, as in the outreach dentist or medic society. That's the sort of thing that they do. They also run things like mock interviews for students who are applying, and it's a really good thing to get involved in if that's what you're interested in. Medical and dental schools are both located on main campus. We're about a 10-minute walk from Newcastle city centre. For those of you that know Newcastle, from Haymarket, the medical and dental schools are about a 10-minute walk, and the medical and dental schools are right next to each other. And as I said before, we're right next to the RVI, which is a hospital, a really big hospital, and the dental school also has its own dental hospital within the dental school as well. There's also lots of opportunities to work as a student. For example, you could be a student ambassador. So that would mean you could sign up to work on things like open days. If any of you have been on any of our recent medicine and dentistry experience days, you might have met some of our student ambassadors and got to chat to them. They do things like working in our summer schools. And I think most of them really enjoy it. They really enjoy getting to meet people, and they get paid well for doing it as well. It's a really good thing to get involved in for the experience, and also to help sort of supplement your income when you're a student as well. So there's lots of different things you can get involved in outside of your academic life as well. So I'm going to move on to talk a bit about the application timeline. So first of all, the first thing you'd probably really be thinking about when you're applying to medicine or dentistry is your UCAT test, because you do that in the summer before you apply. You can take your test between July and September, so you'd do that then, and then you'd start thinking about your UCAS form and your personal statement. So once you've done your UCAT test, you would apply and you'd submit your UCAS application, which includes your personal statement. So sort of throughout that summer, when you're doing a UCAT test, you'd also be thinking about writing your personal statement, and then you'd get your UCAS form submitted in October. Normally the 15th or 16th of October, but it does the date and time of the actual deadline changes each year. So obviously make sure you check that before you apply, because for medicine and dentistry generally, and it's certainly the case at Newcastle, we don't accept any late applications, so you do have to get it in on time. Other degrees might accept later applications. A lot of you degrees have deadlines that are January, but for medicine and dentistry, it is the October deadline. So do make sure you get that in on time. The interviews are then normally held between December and March. So if you're invited for interview, you'd hear back then and hopefully come along to an interview between December and March of the year that you apply. Then A-level results day would be in August. So during that time between interviews and A-level results day, you'd be doing things like hopefully receiving offers. Normally they go around around March time if you're going to get an offer. You'd be doing things like applying for student finance and accommodation. So there's lots of things that you need to do after you've applied to make sure you get everything sorted before you hopefully come to study with us or someone else. And then you'd also need to be thinking about work experience. Obviously, it's something I know you'd be thinking about if you're applying for medicine or dentistry. Work experience is a really important thing to get. I'm going to go into it in a little bit more detail with regards to what we look for and what you need to be thinking about with work experience. But you can do that at any stage. Obviously, it's great if you can get it before you apply, because then you could talk about it in your personal statement or your interview. But really, any stage you can get work experience is a really great thing to have. So I've mentioned already a few times about the UCAT test. And UCAT stands for University Clinical Aptitude Test. And it's a computer test. But any of you who have done your driving theory test, you take it in the same places that you would take a driving theory test in, like an external test centre. So you don't do it at school, you have to go to an external test centre for it. There isn't a curriculum, so it's not something you can revise. There isn't like a certain body of knowledge that you can learn and revise for the test, but you can practice and you can prepare for it, and you really have to practice and prepare for it. Takes around 2 hours, and there's 4 different sections. And what the UCAT test is doing is it's testing different mental abilities, which have been identified by UK medical and dental schools to be important. It's scored out of 2,700, and then you also get what we call a situational judgment band as well. It's not negatively marked, so when you're doing your UCAT test, you can put an answer for everything, and if you get any wrong, you don't get points deducted. So if you're not sure about something, it's really good just to put an answer down anyway, because it's multiple choice. So you've always got, if there's 4 choices, you've got 1 in 4 chance of getting it right. So it's really, if you're not sure of the answer, it's always worth just picking something at random. Because you can flag them to go back to during the test, but it is very fast paced and you might not have time to go back to questions. So we really advise just putting something down if you're not sure of the answer. One thing you do get when you're doing a UCAT test is a sort of wipeable sort of laminate board that you can make notes on, so that you could practice with something like that as well. It's not like a normal pen and paper. It's like a wipe clean sort of mini whiteboard that you get to make notes on when you're doing your UCAT test. So that's when you're practicing for UCAT. That's something you could think about, maybe just a laminated piece of paper or buying yourself a little mini whiteboard to practice on. There's key dates to think about in the UCAT cycle. We haven't got the ones for next year yet, but these they have been previously, so we expect them to be around the same. So registration opens on the 13th of May. So that's when you can go on the UCAT website, sign up and register for UCAT. And then from the 17th of June or around that date, you can then book your UCAT test. And you can book between June and September, and it'll be around those dates for next year. The tests then begin in July, early July, and they end mid to late September. So we advise getting your test booked when the booking opens. Some people prefer to have the test at the start of the summer, so it's not sort of hovering over them all summer. They're not thinking about it, worrying about it all summer. Some people prefer to leave it to the end so they've got more time to practice. I would always probably advise not leaving it right to the sort of final date, because if something was to happen and you needed to change the date, for example, it doesn't give you any wiggle room to do that. So it's also always worth sort of trying to give yourself a bit of time if you did need to change the date, for example, because after the 26th of September or whatever the equivalent date is for this year, you won't be able to take the test. The cost of UCAT is currently £70. There are bursaries available, and you can apply for those from middle of May to the end of September. So there's certain criteria for those bursaries. If you think you could be eligible for that, have a look on the UCAT website and see what the criteria is for those. But otherwise, you do have to pay £70 to take that. If you maybe potentially have access arrangements, if you need any extra support or anything like that at all, you can apply for that through the UCAT website. So it's really worth looking at that well in advance and seeing what support is available so that you can make sure you apply for anything like that that you need before any deadlines or anything like that. I mentioned before there's different sections to the UCAT test, so I'm going to go through these briefly now just to sort of go over what each section of the test covers. So the first one is verbal reasoning. And this tests your ability to think logically about written information. So you can see from that image there's a body of text, and then there's 4 questions based around that body of text. So you'll be given a statement or a passage of text, and from the questions, you then have to use your critical reasoning skills to choose the best answer and to make sort of decisions based on, you know, figure out what the best answer is based on the options that they give you. But as I said before, the test isn't negatively marked. If you weren't sure, you could still just guess. It doesn't use any prior knowledge. There's nothing you can actually revise or sort of you learn before you do this, but practicing these tests really will help you learn how to answer them in the best way. For this section, it's 22 minutes and there's 11 passages of text with 44 items. So for each passage of text, you only get 2 minutes. So for each sort of question, that's 30 seconds. So it is really, really fast paced, the UCAT test, which is why practicing is really important, because you get the practice at how to answer it quickly enough. The next section is quantitative reasoning, and this tests your ability to solve numerical problems. So this, you could be presented with something like a chart or a graph or a table, and then you might have to work out some sort of maths based on that. So you could have to work out percentages or tax conversions. You are allowed to use a calculator, but it is the on-screen calculator. So it's very different to sort of a handheld calculator or a phone calculator, for example. It's the one on screen. So we need to practice using the on-screen calculator. It can be quite different, for example, to a normal calculator. If you type in lots of sort of calculations and you make a mistake, you can't just clear off the sort of last entry. You have to clear the whole thing and start again, which obviously can take time. And with UCAT being so fast-paced, that can be difficult. So you really do need to practice using that calculator in the run-up to UCAT. And for that section, you get 26 minutes and there's 36 items. So again, it's less than 1 minute per question. The next section is the decision-making section. And this tests your ability to apply logic to reach a conclusion or a decision. So you need to evaluate arguments and analyse information to sort of come up with what you think the right answer is. So you might be presented with items that could refer to text, or that you know, as you can see from that example, though it's text, but you could have a chart, or table, graphs, or diagrams. So there's lots of different ways that they can present you with information, and you then have to figure out which is the true statement based on the 4 that they give you. And so for that section, you get 37 minutes and 35 items. So it's around 1 minute per question for that one. And then finally, we have the situational judgment section, and this tests your capacity to understand real world situations and identify the most appropriate response or behaviour in dealing with those situations. So you'll be given hypothetical scenarios, and then you have to make a judgment based to what the sort of most appropriate course of action or what the most important course of action is based on that scenario. And for this, you're not given a score as you are with all the other sections, but you're given a band of 1 to 4 rather than a point score. At Newcastle, we would not consider somebody who got a band 4 in situational judgment. So if you've got that in your UCAT test, it's not worth you applying to Newcastle because we would not consider you. Other universities may consider you. So when you're doing your research in different universities, you need to look at different ways in which universities use UCAT and how they assess your scores. For this section, you have 26 minutes and there's 69 items for the situational judgment. And for all the UCAT sections, as I've said already, you can't revise specific information or curriculum that you can't revise for UCAT, but practicing is really important. There's lots of different ways you can access UCAT tests. The free one is using the UCAT website. There's lots of example tests on the UCAT website, example questions, practice tests on there, and that is completely free to do that. There are paid subscriptions that you can use, but you don't have to use them. The UCAT website on its own should be sufficient for you to practice, but a lot of students do use things like Medify, which is a paid subscription. So you could look into that as well, but we certainly don't say you need to use that because the UCAT website does have everything on there that you need to practice UCAT. So the next stage of applying to university is your UCAS form. Obviously, your UCAS form is where you do your choices, decide where you want to apply for, you put all your personal details on there. Your teacher will do a reference, but you also have to do a personal statement on your UCAS form as well. So your personal statement is 4,000 characters, and you get one personal statement for all 5 choices. So I'm sure most of you probably know that for medicine or dentistry, you can apply for 4 medicine or dental schools, and then you get a 5th choice, which is something separate to medicine or dentistry. So you have the same personal statement for all 5 choices. So for that 5th choice, it is worth checking with the university or the degree whether or not they require a separate personal statement, and they might ask you to send that in separately, so via email or via their university portal, for example, because it will be the same on your UCAS form for all 5 choices. And because of that, in your personal statement, we really advise not to talk about any specifics for any university, because that obviously then rules out the other ones potentially from considering you. So try and make it suitable for everywhere that you're applying, at least for the medicine and dentistry courses. For most of our degrees, if it was your 5th choice, you wouldn't ask for an alternative personal statement. But as I said before, check with each degree and each university you're applying to for that 5th choice if they require you to submit a separate one. Your personal statement is your chance to tell a university why they should pick you to study with them. It helps you demonstrate to us why you'd be suitable for university life and why you'd make a good medicine or dentistry student. Universities use them in different ways. They can use them to consider similar candidates. So if they've got 2 candidates, for example, who are predicted or who have achieved 3 A's, they might look at your personal statement to try and sort of differentiate between you and make a choice as to which one to make an offer to. Some universities use it for their interview questions. So they might pick things out your personal statement and ask you to talk about them more at interview. So you must be prepared for that. If you're going into interview, you need to know your personal statement inside out for those. At Newcastle, we don't do that for medicine, but it is worth checking to see other universities might do that. Deciding on near miss is another way in which universities can use personal statements, and this is something Newcastle do when it comes to A-level results day. If you've got an offer, for example, based on 3 A's and you get AAB, but we could potentially still consider some students who've got AAB, we might then look at your personal statement to see which students sort of would make the most suitable medicine or dentistry students, and for any other degree, and that's when we would look at your personal statements. So on the personal statement on UCAS used to be one big body of text that you just wrote, and you had to decide how to structure that yourself. But now, from this year, you get 3 questions, which really helps you to structure your personal statement. I think it's a great thing that it's been introduced, because it saves you having to sort of worry too much about how to structure it. So the 3 questions that you would have to answer in your personal statement are, first of all, why do you want to study this course or subject? How have your qualifications and studies helped you to prepare for this course or subject? And what else have you done to prepare outside of education, and why are these experiences useful? So to get started with your personal statement, it can be really hard. But I think I mentioned earlier about keeping like a reflective journal and starting to take notes down. So if you're attending anything like the mini medical school lectures that you've already attended, if you've attended any other university open days or experience days, or any work experience or hobbies or anything at school that you're sort of think, oh, that would be really great to put on a personal statement, keep making a note of it, note down thoughts, and that'll then help you pull together all your ideas, and then also identify any gaps that you need to address. You need to think about why you want to study your subject and try and make that personal to you. Show what you've done to understand the career. We want to know that you understand what it takes to be a doctor or a dentist, to know that you've done your research and you know why it is you're applying to that degree. We want to know what your key skills are and how it relates to your degree. Is there anything a little different about yourself that would make you stand out? Why should we pick you over another student? Anything you want to do at university apart from studying, so you can talk about that. Any sports, volunteering or clubs that you already do that you might want to continue, just to show that you are more well-rounded. That's a really great thing to demonstrate in your personal statement. When writing your personal statement, speak to your teachers and UCAS advisors, ask for tips, ask for them to read through them, give you feedback, ask for honest feedback. You should expect to do quite a few drafts of your personal statement before you get it finalised and ready to submit. But you really need to be asking people who are going to give you really constructive feedback when you're writing it. So just to cover that, what to be thinking about including in a personal statement, just to sort of recap all of that. So think about why you want to apply for medicine or dentistry. How do your current studies relate to that? And what has made you want to study the course? You could talk about your past experiences, but I would recommend only mentioning those briefly. Think about why university, linking any academic skills that you've had and how they'd help you at university. And talk about what you know about the course and what particularly interests you. Just to show that you've done your homework. But as I said before, don't talk about any specific university. If there's something about a specific degree that interests you, I'd really recommend not putting that in your personal statement, because that could then rule out other universities from considering you. And unless you're only applying to one, obviously you want to be giving yourself the best chance at all universities you're applying to. So thinking about your skills and achievements, First of all, I would advise thinking about what skills you need to be a doctor or a dentist. So we've got some here. There are more, but these are what we're sort of looking for in your personal statement and interview at Newcastle. We're looking for you to demonstrate your empathy, your integrity, your communication skills, resilience. If you can show examples of when you've can demonstrate leadership or teamwork, for example. These are really great things to demonstrate in your personal statement and also at interview as well. So you can think about your hobbies and interests, thinking about what makes you interesting. We see thousands of applications, we read thousands of personal statements. So we want to know why we should pick you and what would make you a good student on our degree. So how do your hobbies or interests demonstrate the skills that you need for medicine or dentistry? So for example, if you're a member of a sports team, that could demonstrate loads of different things that we're looking for for a medicine or dentistry student. It can help demonstrate teamwork. You could use an example for adaptability. For example, if you've had to change plans last minute, or you've had to take a different position in the team at last minute, and you've had to be adaptable. Obviously, communication if you're communicating with your teammates. Commitment if it's an ongoing thing that you're doing every week. That shows commitment. Or organisation, just organising that around your school life and your studies is a really great example of that can link back to medicine and why that would make you a good medic or dentist. So just to go back to personal statements, the best thing to do with anything you're talking about in your personal statement is to link it back to medicine or dentistry. It's no good just saying, I can demonstrate good teamwork, but then link it back to why that would make a good medicine or make you a good medic or a dentist. You need to be backing up your examples and showing why you're telling us about that. The next thing I'll move on to is to talk about is work experience. And I know a lot of people worry about getting work experience, and it is really important to get. But it's not really about what you've done, it's what you've been able to gain from that experience. So what have you learned from the experience? And again, like all your other skills, how it links back to medicine or dentistry. So what work experience have you done? You can talk about that in your personal statement or interview, and then talk about what you noticed or what did you learn from it and how it relates to medicine or dentistry. And as I've said before, we recommend using a reflective journal to note down your experiences, because that could save you a lot of time when it comes to writing your personal statement and preparing for interviews. For dentistry at Newcastle, we do require a minimum of 10 days work experience, so that is something to think about. For medicine, we don't have a work experience requirement. Other universities might do, so it's always worth checking admissions policies for every university you're thinking of applying to, just to check what their work experience requirements are. There's lots of different ways of trying to get work experience. You could check your local NHS trust. Most NHS trusts, if you just Google, for example, if you're in Newcastle, search Newcastle Trust or Gateshead Trust or wherever it is you're from, or your local trust that are nearby that you could travel to. Most of them will have an online web page to tell you about what work experience you can apply to with them. Some of them you can apply to online, and they will have certain windows where applications are open or closed. So it's worth checking that sooner rather than later, because you will want to miss any application deadlines. They might have certain criteria. For example, some will only consider people who live within that area. Some might consider further afield. So it's always worth checking all that criteria to make sure you don't miss any deadlines and that you meet what they're looking for. You can also check your local GP, who might offer shadowing experiences. Or there's other opportunities like St John's Ambulance, or you could work as a healthcare assistant. Or you could just research the career. This could be things like conversations, listening to podcasts, reading journals, for example. And it doesn't have to be healthcare related. Remember, there's lots of transferable skills. So even if you have a job in retail, for example, there's lots of transferable skills that you can talk about what you've learned from that. It could be dealing with a difficult customer. It could be time management. These can all be linked back to medicine or dentistry. And as I said before, for medicine, work experience isn't essential, but it is encouraged. But for dentistry, we do require at least 10 days work experience. As you can see there as well, there's a list of all the different virtual work experiences that are available. So you could have a look at those as well and see if there's anything like that you could sign up for. The next thing to think about on your UCAT application is your fifth choice. If you apply for medicine or dentistry, you only get you can only apply for 4 medicine and dentistry schools. And part of the reason for that is because they're so competitive. 4 choices That's why it's limited to 4 choices per person for medicine or dentistry. But you do get a 5th choice. It can be something else. You don't have to have a 5th choice. You can just apply for those 4. But having a 5th choice and something else can sort of help keep your options open. It gives you a bit of a backup plan if things don't quite go to plan. And some people end up going to study their 5th choice and really enjoying it. And then, or some people might do their 5th choice and then go on to graduate medicine, for example. If you do end up studying your 5th choice, it doesn't necessarily mean you're not going to get to where you want to be in life. There's lots of different options. At Newcastle, biomedical sciences and pharmacy are really popular choices for a 5th choice. We also offer dietetics, human nutrition, psychology, and sport and exercise science at Newcastle. Other universities offer things like nursing, paramedic sciences. You could also do something completely different. You could do something in humanities, for example, like English, history. You could have that as your 5th choice, or you could have no 5th choice at all. So there's lots of different options when you think about your 5th choice. And so, as I said before, one of the reasons for having a 5th choice is because getting into medicine and dentistry is extremely competitive. Now, these data is for medicine. So if you're interested in dentistry, it would be different data, but it is still very competitive to get into dental surgery. But as you can see from that data there, which is from 2023, only around a quarter of applicants get into medical school. Some may reapply if they do retakes, or they just reapply if they retake UCAT, for example. Some might do their 5th choice and then go on to do graduate entry medicine. Some just end up going down a completely different path altogether. So it is important to explore all your different options, to be aware of what else is out there. But it also could just help strengthen your desire to be a medic if there's really nothing else you want to do. Exploring those 5th choices could be, could just really make you realise you want to be a medicine or you want to study medicine or dentistry and nothing else, and that's absolutely fine. So the next step to think about is interviews. At Newcastle, we do multiple minute interviews, and this is how we interview for our UK home students. This will be on campus, and for multiple minute interviews, you'd come in, you'd come onto campus, and there'd be 7 different stations. So each station would be a different question or a different role play scenario. There'd be 7 stations, and each one would be 7 minutes. You'd have a short break in between each station. Some universities might have more stations than that. They might have different, the stations might be different at different universities, so it's worth reading different admissions policies, going to sessions like this at different universities to find out what their interviews are going to involve. But as at Newcastle for medicine, are multiple minute interviews, and that is how most medical schools will interview. For dentistry at Newcastle, we do traditional interviews. These are panel interviews, and these are probably what you'd be more used to if you've had a job interview, for example. This is how dentistry would usually assess interviews, and it's how we do it for dentistry at Newcastle. It's typically conducted by 2 selectors, sometimes a clinician, sometimes one of them might be a layperson, somebody who doesn't work in dentistry or isn't a clinician, could be there as well. They take around 20 minutes, and they could be in person or online. At Newcastle, what we're looking for in your interviews are these different areas. That's similar to what we already mentioned before, the personal statement. So we're looking for you to demonstrate all these different competencies. So personal statement, personal organisation, integrity, teamwork, and as you can see, all those others there. We want to know that you're compatible with our medicine degree or with our dentistry degree. We want to know that you're compatible with those, and these are all the things that we would be looking at to demonstrate that in your interview. There's lots of different ways you can prepare for an interview, but the one of the best things to do is to read over different university admissions policies, which I've said before. Check what they're looking for, check that before you apply, check that you are actually going to be considered. And then when it comes to your interview, check what they're looking for in the interview as well. Check if they're going to be using your personal statement, as I mentioned earlier. We don't at Newcastle for medicine. We may do for dentistry, so it's worth checking that to see whether or not you need to sort of read over your personal statement again before you go for your interview. Have lots of examples ready. So, for example, all those different competencies that I just mentioned before, think about different examples for all of those. So you've got lots of sort of answers in your bag that you can just pull out and talk about, and you practice them lots. You've sort of well equipped to talk about them at ease. Practicing is really important. So keep practicing, asking your friends, parents, family to practice recording yourself just by yourself. You could do it as well. So it's really important to practice interviews so that you come across as relaxed. You don't want your answers to seem too rehearsed. So it's really important to practice just to make sure you can just pluck out those answers. Whatever you're asked a question, you've got those answers and you're well practiced to be able to do that. You could do things like mock interviews as well. Potentially your school might offer those. So that's something that you could try look into doing as well. So I'm going to cover our admissions process, admissions policy. I'm aware of time and I want to leave time for questions. So might have to cover this fairly quickly, but I will after tonight. There is a link on our YouTube channel to our admissions policy, which I will send you, which goes into this in more detail as well. So I'll cover this very quickly, but I will send you the link to the video of it on YouTube as well. So our offers are based, this is for medicine, it is different for dentistry, which I'll cover shortly. Our offers are based on 50% of what we call an academic score and 50% of your UCAT score. So when making offers, we look at those two things combined, and then we decide those top students with those top scores we would make an offer to. So the academic screen is the first thing we are looking at, and that is what makes up this academic score. So the academic screen is based on your most recently achieved grades. So for a lot of you, that'd be GCSEs. For some of you, it might be A-levels, and for some of you, it could even be a degree. So if we're looking at your GCSEs, for example, we take your 8 highest grades. So you can see there, a grade 9, for example, is 5 points, a grade 8 is 4 points, and so on. So we're getting your 8 highest GCSEs, and we are giving you a score out of 40 for those. And then we look at your UCAT score, and for that, we give you a score out of 60. So from there, you can see that if, for example, you got a score of 2,300, you would get a score out of 50, a score of 50 out of 60 for your UCAT. And those two things combined give you a score out of 100, and that gives us your academic screening score. And that is how we then decide who to interview. We take those top 1,000 academic screen scores, and that is who we invite to interview. And then we then look at that score and your interview score, we combine the two, and then that is how we decide who to make offers. So you get your academic screen score, you get your interview score, and then we decide whether to make you an offer. As I mentioned earlier, from those who get a UCAT situational judgment score of 4, we wouldn't even consider you for interviews. So it's important to remember that because it would be a wasted choice if you applied to us and potentially other universities as well. But you need to look at the other admissions policies to find out about that. So for dentistry, it's a bit more straightforward. Offers are just based on your interview score. So we look at your UCAT score, and then we decide whether or not to invite you to interview. We take those top UCAT scores and invite to interview, and then offers are then based on the interview score alone at that stage. It's worth noting for both dentistry and medicine, and for all degrees, we also look at your predicted grades. So when you apply for medicine or dentistry, you need to be predicted the grades that we're looking for. That's sort of the first initial check as well before we do your academic screen score as well. So we would only then consider for interview if you're also predicted to meet the grades as well, if you haven't already achieved them anyway. So that was a very, very quick overview of our admissions policy, but I will send you there's a video that goes into a bit more depth that I'll send you so you can watch that in your own time as well. I'm now going to talk a bit about our partner supported entry route, which is as they say, supported entry route into Newcastle, from which you get a lower offer. There's a summer school, which is completely free to attend, and you get lots of extra help and support as well. Over the years that we've been running partners, we've had over 9,000 students who have entered the university via partners. It's for all degrees at Newcastle. It's not just for medicine and dentistry. You can come via partners for any degree at Newcastle. And it's for students who meet certain criteria. But I'll go into that shortly in the next slide after this one. So if you apply via partners, you could get an offer that's up to 3 grades lower than our typical offer. For medicine and dentistry, it is very important to note you'd only get an offer that would be 2 grades lower. It's not 3 grades lower. So for example, the typical offer is 3 A's for medicine and dentistry. And if you came via partners, your offer would be ABB. So you'd get 2 grades lower for medicine or dentistry. But other degrees, it's 3 grades lower. So that example there, chemical engineering, our typical offer is ABB. If you came via partners, your offer could be BCC. And you also then have to, as well as achieving those grades, you'd also have to complete our summer school as well. That would form part of your offer too. If you wanted to look to see what course you're interested in, if it's not medicine or dentistry or chemical engineering, that's that one we've put there, have a look on our entry criteria. They're listed on our entry criteria for all of our degrees on our website. So if you just go on our homepage, you'll find that all on there. So how do you get accepted onto partners? First of all, you must meet the essential conditions, and they are things like being a home student, so not being an international student, never having done a degree before, things like that are the essential criteria. And you also then have to meet 1 or more of the 14 eligibility criteria. The eligibility criteria are things like being eligible for free school meals, being the first in your family to go to university. There's lots of different criteria. Go on our website, search for partners, and there's a Really simple tool to use where you can go on to check if you're eligible for partners. There's some things where it's based on postcode. For example, if you're from a postcode where not many people progress on to university, that can make you eligible for partners. So even if you don't think you might be eligible, it's always worth going and checking if it's something you're interested in. And then also you would have to make us your firm choice. So if you apply to us, you get offered on, you get accepted onto partners, you get a degree off, a conditional offer. You would then also have to make us firm choice. If you didn't, we would revert your offer back to the standard offer. So you would not have the partners offer anymore. To apply for partners, you would submit your UCAS form and you'd put a P on your UCAS form in the relevant box. And you'd have to make sure you apply by the relevant UCAS deadline too. You'd also then submit a separate partners application form, which you can do on our website. And then the partners team would assess your eligibility, and they also notify admissions so that they know that if they're making you an offer, you would be getting the lower partners offer.